Go on, Craig, you can go first.
Thanks very much. No problem at all. Sorry. Again, always technical issues. This should never allow me anywhere near a PC. Sorry, so I'm Craig Brown. I'm now part of the BSGA. I should say part of. I've been involved with the BSGA since 2000 on various capacities. Technical committee, stepped into the role as the MD through the COVID period, and I'm now chair as our new MD, Linda Edwards, has taken the role on. History in the sign trade, joined the sign trade in 1984 as a YTS trainee, and has kind of worked through a number of businesses, including Signs Express and being the franchisor a good period of time, and stepped away from that business in 2018, supposedly for semi-retirement. But as most people who are in the sign industry know, you never get away totally. But something I absolutely love. So hopefully today will be informative for everybody. Hand over to David.
Thank you very much. David Allen, one of the ops managers for the Signs Express franchisor, 25 years in signage. I'd like to say man and boy, but I didn't start till late. So yeah, 25 years in signage. Between us as ops managers, we have over 60 years in knowledge of it and experience in signage. So pretty much help everybody out with what they need. We're there for training, staff support, products, suppliers, etc., for the franchisees.
Great stuff. Okay. So, do you want to do this a little bit, David?
Yeah, I can have a look at this one. So yeah, before we begin, we're not here to interpret regulations. That's what you guys do. We're here to help you produce functional signage. But it's not just signage. There are so many additional products we can offer to enhance the patient and visitor experience. So it doesn't have to be a health and safety sign. It doesn't have to be a warning sign. Yes, we produce those, but we can produce them in a way that makes them a lot more visually attractive, a lot more appealing. It doesn't have to be basic.
Yeah.
Okay, so yeah, what we'll cover, it's obviously the signage in the healthcare, the CQC questions, 5 key questions, how to audit your premises, your space, any additional considerations and examples, and some of the next steps. We find that the key takeaways hopefully will be around consistency of signage and language, and then a few ideas of what signage can be. Signage, as I say, signage doesn't have to be simple. It can be effective, but also aesthetically pleasing. So hopefully we'll give you a bit of inspiration on what we can do and how your signage can look going forward.
Okay. So signage in healthcare, and I think one of the things that causes a little bit of confusion, especially with hospitals and trusts, is the fact that people will interpret the CQC guidance slightly differently. CQC itself is not legislation, but it is regulated by the Health and Social Care Act of 2008. So the irony is that what you see within the industry is people providing solutions, and they are slightly different. So you can go into a hospital in Norfolk, and the trust will interpret the structure slightly differently, say somebody in Lincolnshire or somebody further afield. So it's really a case about how you make the experience for your patients, clients, easier. At the end of the day, right the way from the process. So as I come onto site, am I in the right place? As I walk into the building, am I going to the right area? And actually, have I come to see the right person? So it really is actually taking you through the process as though you've never been to the site before. And I think that's where if you come back to its most simplistic terms, you are trying to guide somebody through the process, no matter what their orientation, their language skills, their educational skills. So push on. So you're saying the must-haves, and again, this might seem very obvious. It's the health and safety side of the outlook. So your health and safety being fire exit, any points of contact that might cause issues, And again, those things itself almost are viewed as common sense, and they fall within a process of actually building as it's actually constructed, as it changes. Those things should be regularly mandated and viewed by a person within your own business. Let me come back once. Sorry, Grace, one slide. Just come back one if we could. Sorry, it's flipped on. The one thing that the CQC ratings displayed is something, again, I see randomly put in various different formats. And again, you can sometimes see it with banners, you sometimes see it with plaques. The fact that the ratings should be put on within 21 days of the ratings being compliant, but it also gives the client, the patient, a degree of knowledge that they wouldn't have if those ratings weren't there. It's one of the the benchmarks that people are actually trying to achieve. So sorry again, Grace, we move on. And then you say they should have. So I come this back down to a bit of logic. The people who work in the building know where actually everything is. What you tend to find is you come onto a site, it's not immediately obvious where you go. So if you were a new starter within the business, could you find your way to the car park? From the car park, can you find your way to actually the part of the building you're meant to actually visit? So the wayfinding systems itself are imperative to actually to get right. And that's where I think someone like a sign professional, someone within the Signs Express network, can actually walk you through the process of actually how you guide through a building. And whether that be color-coded systems, whether it be apartment, again, a process that's obvious for people to actually follow through. That's one of the things that I see a real mishmash wherever you go. And it's not just the fact of actually someone coming in, it's what happens when a department changes. How easy is it to change that wayfinding system? So it's actually thinking about the actual length that system will actually be in place and being able to update. And again, the could-haves, if we're actually talking, the backdrop there is actually a children's area. Someone's actually a youngster coming into a hospital, it's intimidating. So how do we actually make the area as friendly as possible? And it's actually to show what the hospital is all about. We've all been into, again, hospitals where there's actually a poster on the wall, there's actually had something stuck over the top, or it's pulling away from the wall. These are the things that actually reinforce the quality of the service that a patient or client is actually going to get. And often there's not, because you're going into the building on a regular basis, maybe you actually don't see the things that aren't working for your patients and bringing them as an area of comfort. It's back to you, David.
I'll just unmute myself. Okay, thank you. Yeah, so we're looking here at the 5 key questions that we've gone through the regulations, and there's 5 key areas of key questions that we can help with signage, identify signage, and hopefully help you help your patients. So those 5 are: Regulation 9, person-centered care, dignity and respect is 10. Regulation 12, safe care and treatment, 15, premises and equipment, and 17, governance. So how we've interpreted those is the responsiveness. So not adding stress to what can always be a stressful experience. Let's provide clear, concise, easy to follow signage. The dignity and respect, where we've got dignity, let's look at ensuring lack of embarrassment, so we can use privacy screens, privacy films, clear signs to say this is an area where people need to be left alone, need to be quiet, people are undressing, etc. There's ways we can do that with screens and films and signage. Obviously ensuring safety. So yes, we have to have some health and safety in there, but let's make it accurate, let's make it appropriate. Let's not take people to dead ends. Let's keep it simple and concise. And then we've got accessibility. So we need to be clear and easy to follow wayfinding. Common language, using colours, using pictorial signage, or a combination of all 3. Let's make it easy for people to find their primary destinations, when they come out of the car, where they're going. Let's make it easy and make it consistent. So if they're going to following the red route to an outpatients department, the signage in the red route, once they get there, needs to be read. So let's keep it common. Let's keep it consistent. And then governance. So obviously we need to, as Craig said, we need to display your legal required information, but that needs to be up to date. So if a department or a member of staff has moved, then we need to replace their the information that is relative to those people. And then obviously to do this and to help us with this, we like to audit that space, those premises. So what we start with is ideally we need to look at the space you've got available. Just because you walk around it every day, you miss things. So I'll give you an example. In a previous role, we removed over 1,000 signs from an airport to enhance the visitor experience, which sounds a bit contradictory, but it did. It was getting confusing. So we removed the signs and didn't have a detrimental effect on the building and the passenger experience. So just because you walk it every day and know where you're going, let's think about the patients, visitors, etc. So how do we start? So let's start with a floor plan. If you don't have a proper drawn architect's floor plan, then physically draw one on some graph paper or a computer system. But let's think about how we're going to get people from the car. And we call these the primary destinations and secondary destinations. So on this floor plan here, for example, a primary destination would be the reception area or the pharmacy. So let's get people into the building. Yes, we can mention the other departments in that building, but the primary wayfinding should emphasize the primary destinations. Once they're in the primary destination, then we can look at the secondary one. So we can point the consultancy room, the counselling, the phlebotomy, etc., toilets. They can all be done with other signage once they're there, but let's get them in easily. People, men especially, don't like asking for directions, so let's make it easy for them. Let's get them out of the car and into the building first time. On the other things to notice on here, there is an outdoor play area. Now, it doesn't look to be any clear access to there from inside the building, so we either need to get people there from the outside, or we need to make it clear how they can get there to the inside. Do consulting rooms need interchangeable door signs? Is consulting room one always there? Is the consultant in there the same consultant, or do we need to be able to change those signs? The easy way to get to those rooms, we can use door signs, we can use projecting signs. Just remember that on the back of the projecting sign needs to be the arrow pointing the other way to get people back out again. So, but that's where we can highlight those. Again, let's think about the commonality of language. Is counselling called counselling on the appointment card? Is the address, is counselling always been there, or has it been in a different room or a different floor? So let's make it easy. Just because we have 5,000 pre-printed appointment cards and they're in a storeroom doesn't necessarily mean we should be using them if that journey is going to be hampered by using them. So think about that. Is the building and the block clearly marked from the car park? Are the floor levels clearly marked? So when people have finished, can they find their way back out again as clearly and easily as they find their way in? So when they get to the primary destination, they can ask a member of staff. On the way out, there might be less staff to ask, so they need to be able to find that way out. People on their way out will need it to be simple. They could be distressed, they could be anxious following a bad appointment, or they don't like the situation they're in, or the building they're in, or the people that are around them. So think about that. Let's make the journey as seamless as possible, both in and out of the building. So first thing first, start with your audit. Have a walk around. Don't have a preconception of what you're going to see or where you're going. And that's where it's useful to get a signage company involved early on, because we will approach it in a totally different way to yourselves. So because you know where phlebotomy is, we don't. You have you roughly know where the arrow is going to take you. We won't. We will look at it totally differently to you. So it's very, very useful to get a sign company involved early on. So we've put together some basic questions here that you can ask yourself while you're conducting the audit or before you start. And these will may seem obvious, but it's amazing how easy obvious things are to bypass or to miss. Over to you, Craig.
Yeah, okay. If we can flick one more slide on, Grace. So again, we're saying we're identifying areas where the sign that people understand where people should actually go, and this kind of ties in with what Dave was actually saying about walking the floor. So the fact that you know your facility probably inside out, somebody else coming in doesn't. One of the things that I'm surprised a lot of people within the sector don't know is actually that there is a wayfinding guide actually within England NHS. It's a 132-page document that gives you an overview of positioning and suggested positioning of signs. So again, rather than going in cold, it actually shows you the likely positions, and again gives you the idea of heights, the positions for people coming in wheelchairs and actually partially sighted. So again, the fact is that you can walk through your facility and actually point people in the direction that they need to go. So again, it means that there's no delay, there's no embarrassment, there's nobody actually having to actually stop a member of staff to find out where they need to go. So again, it's trying to make the process as simple as possible as somebody walks through your facility and they can actually get from A to B in the shortest amount of time. If we again flip one more on, this is a prime example because we always assume, and again, I'll speak as someone who's actually been diagnosed as dyslexic in a later life. I'm a very visual person. So the fact is, color coding an area for me makes a great example of actually, I need to head for the green area. So actually the text might be green as well, and someone can actually then follow that path. And it almost means they don't have to have English as their primary language or first language. It just makes the process that much easier to get through. Again, we can go on to the next example. I think dignity was down to you again, wasn't it?
Yeah, backwards and forwards. It's great. You can have a breath. So yeah, dignity. Okay, Grace, let's go. So dignity, yes. Consultancy rooms, please knock use in use signs. So sliding signs are great if people remember to slide them in the right direction. Sometimes a permanent sign might be better. Better to knock and wait, even if the room is empty, than just walk in. People generally don't like asking where toilets are for some reason. So clearly marked toilet signs with directional signs remove people's embarrassment, especially if they're asking for a particular room or area. Privacy films are great. Privacy film, digital signage or acoustic screens can help make people feel more at ease if they're getting undressed or feeling vulnerable or emotional. Clearly mark staff areas or private areas. We don't want visitors walking into areas where they shouldn't be. It saves embarrassment and awkward questions. And signs can be discreet. It can also clearly identify the room or the area, but signs can be designed to be considerate to that area and match and be in keeping with the situation or the area that they are going to be used in. Example there. So you've got the privacy films on the windows. Obviously, you've got another option where you can use something like contravision, which you can look out, but you can't look in. In the olden days, when we first started, it was only one option. You could, if it was dark outside, you could then see into the room. Things have changed, and now you can use contravision in the night, and it's if the lights are in the room, then it's not visible from outside. So things like that are very useful.
I think the other thing that they're Dave with those window films is the fact that you can remove heat from a building. Again, we've had this big glass structures, and obviously the issue that people have had is the air conditioning is pumping out. And people are trying to be environmentally friendly now are looking to have other options, so something that will reflect the heat back out of the glass. But again,
yeah, it can help. Yeah, absolutely, it can help prevent thermal shearing when the glass cracks as well. So yeah, absolutely, all these things.
Yeah. So with the safety, the safety might seem very obvious. So this is things like I'll go as basic as a safety sign to exit the building. You know the fire exit route, the quickest route to the assembly point. But there are other things that you need to take into account. So if you're in a dentist practice, actually where sharps might be put, now they're clearly marked. The same, you know, a room that actually contains X-ray equipment, you don't want the general public just walking in. So the pictogram is very important to actually to highlight those areas. And again, that's where probably an audited walkthrough is actually a sensible approach. As Dave touched on earlier, the fact is you're in the building all of the time, you know what is behind that door. The general public don't. And if they're unsure, it's the second door on the left, they've been told by reception, and actually they've miscounted and they walk into a room that has hazardous material onto it, the buck stops with you as the proprietor. Whereas actually if the signage is on the door, it might just stop someone for a few seconds from actually doing it. So it's the process. So I'm now walking onto a ward. I actually want the person walking into the ward to clean their hands. Well, do they know that the dispenser is on the wall? Is there clearly defined signage, or actually something pointing to someone to actually something that you want them to do before they come onto a ward? I'm now touching a touch point. Actually, before you touch the touch point, can you do something? So you don't want to proliferate the site with too much information because you get the information overload. But having an audited process and an audited walkthrough, I refer back to the wayfinding guide that they have on NHS England. It's a meeting, 132 pages. It's very much bedtime reading, but it is actually a very sensible approach, and it's something that has been updated on a regular basis. So even if you don't use the whole process, it just gives you an underlying understanding of actually a guidance systems, the things that you might actually want to do. PPE notices the same type of scenario. It's usually for the disposal of, but again, if somebody's coming into an environment where there are patients that are high risk, again, the instructions need to be clear and concise, and that will actually be down to the individual. The last bit on there, the sharps and clinical waste, every medical establishment will actually have them. And again, it's actually one of those areas that everybody says they do, and surprise, surprise, when it leaves the building, goes at maybe that wooden storage facility that they've been put in before they're actually taken away by the waste collection people, hasn't got the notification on that they should do. Again, that's one of the ones where lots of people seem to fall down. And again, if you've got some examples there, I wouldn't, again, is there a minimum size? This is the thing that you have to think about with some of these health and safety signage, the positioning of the signs. I would probably say the one that you actually see at the bottom there is kind of a nice looking sign, whereas you would probably go with a larger graphic on the machinery it's actually itself. So again, now the things where you can look through where the guidance will give you a height. Bear in mind the pictograms themselves are developed as things come online. So if you go back 10 years or 15 years, there wasn't such a thing as sharps at airports. So somebody had to come up with a pictogram. Everybody has then adopted it. That's the nice thing by working with sign companies that are affiliated with their own trade associations. We can actually work with BSI to actually to make sure that the standards that they bring out, again, not regulatory, but advisory, can actually then be adopted and actually taken through. So, I think that's back to you, Dave.
Yeah, accessibility. Okay. Yeah, so let's have a. Okay, so let's look at position and type of signage for that particular situation. So can people get to the car park? So, and finding a car park in the first instance can be difficult, especially in large establishments. So colours and or large letters and numbers really help this. So rather than having lots of signs that say West Car Park 3, let's have a red sign with text W3 on it. But as long as that's consistent and common through the appointment letter or the appointment card, people know what they're looking for. Let's keep that going. Arrows, projecting signs and hanging signs are all good options to get people to their destinations, secondary destinations, primary destinations, towards the toilets, the lifts, consultancy rooms. And at the end of the day, legible directory signage. So at the primary destination and junctions of corridors and each floor, let's have a directional board, but let's make it clear. Let's make the arrows nice and clear to keep that consistency of colour and language. Even if there's temporary signs for building work or maintenance work, there should be temporary wayfinding signs. So still need to provide clear and accurate information so people don't go the wrong way, don't go end up in a dead end. Certainly, and especially for emergency signage, we don't want to send people in emergency down a dead end. So if there's lots of barriers there because people are working there, or the lifts are out of order, we need to tell people in advance and provide an alternative route. And yeah, pictorial, great, braille, multi-language signs, they're great as long as they're not at the first place. They need to carry on through. So they need to
Can
be
I add?
used
Can
in the
I add one?
maps, etc. You can, of course you can.
Yeah, I was just going to say the braille signs is something that often trips a lot of people because understand the percentage of people who are blind who can read braille is only about 10% of the blind population. Hence the reason we talk about tactile, which is raised letters, so somebody can see. So the positioning of where those things are placed is important for someone who's partially sighted to know where to go. So within the door frame, to the left of the door frame, the height is actually set. But I also see the specification for hanging signs to be in tactile format. Now, with the greatest respect, hanging a sign at 2.2 meters and expecting to be tactile is just a complete waste of everybody's time and money. So it's the process that you actually go through to arrive at the right solution is as important as the signs. Now, obviously, the braille and tactile fall under in effect, the Disability Act or Disability and Discrimination Act. It's a case of actually trying to do the best, and again, best practice for those signage. Again, the amount of that signage that's in place is kind of down to the people who are actually using it on a regular basis. So again, think about your patients, think about who's coming into the building, think about the necessity to actually accommodate the people who come into the building on the most regular basis. I know that's a very general comment, but again, this is advisory best practice.
Absolutely, and the use of color is very important in that as well, because obviously you could use shades of blues. Well, that's not necessarily easy to determine when you have difficulty with colors and things like that. So those sort of things, absolutely, yeah. There's a few examples on the next slide, I think.
Yeah.
Yeah, so obviously we've got the directory, which is clear, concise, and color as well. And then obviously that's a lot easier to change. That system there on the left is a slat system. So each individual slat can be changed, whether it be color or wording can all be changed and moved around. So if the North Shore surgery, that's not easy to say, moves from the first floor to the ground floor, we can remove that slat and change it and then put it back in again in the right place. The one in the center, in the middle, that's, yeah, different signage, but it's still clear. It's not crowded. There's not lots of signs or wording and lots of arrows. It's keeping it nice and simple. And then obviously the last one is just an idea of the sort of signage we can get you to into a building and around the building. So yeah, it's good. Back to you, Craig.
Yeah, no problem. So governance, again, what we're talking about is actually making life as easy as possible for the people who are coming in. So the public entry, what they're saying, where you come into the building, where you're highlighting your CQC rating. And again, as you said, that has to be put into place within 21 days of the rating taking place. It can be in a number of different formats. Most regularly, we see it in banners because actually people who have been regular or gone up a level want to kind of shout about it. But the other thing is actually it has to be in an area where people actually will see it. If your rating's poorer than you'd like it to be, you can't tuck it out of the way, is where we're actually coming from. The practitioner's name is something that you see more often at dentists and doctors' surgery. Hospitals tends to be, again, with the greatest respect, you see a slat that's been handwritten or done over the top. It frustrates me mightily, but again, I suspect with the dry whiteboards that are constantly in use, that's what actually happens. But the registration number of the practice tends to go with the smaller practices, the doctor's surgeries, those type of elements as well. Now, we've got words there about the signs within the building. You'll often see that people move into a building and a building is readopted, and then bits and elements will be mismatched. I think that's the thing where people get confused. And again, that's why thinking about what you're doing right at the front end, what's the longevity of the sign, how much is interchangeable, how much can I actually update without huge cost, is a big part of where it comes from. And that ties in with that branding and consistency. So you've got an old logo or the old practitioner, or actually someone who's left the practice, his name is still there, or a piece of masking tape is stuck over the top. It just doesn't give the right impact. But also think about how you're displaying in effect, the posters that are provided by the NHS or the bodies that you actually work with. How are they displayed? Are they just stuck onto a wall with a bit of blue tack, or do you have a poster frame that actually holds them? If your posters are standard sizes, which they tend to be, standard paper sizes, maybe actually having those frames put in situ as people come in the regular places they're seen, with a polycarbonate face that's bonded in so it won't fall out when you flip the frame open, is a sensible approach. But again, your sign professional can talk you through that. And again, there's the example of the banner we mentioned before onto a wall. Again, for me, if it's something that you're proud of, maybe making it a little bit more of a permanent feature than the banner is a nice thing to have. Again, can be upgraded. And again, we've got the wall there for the dental practice. So again, as you look down, that's actually a polycarbonate onto. I'd imagine they've done that because it's engineering brick. It's hard to drill into. Then the clear polycarbonate on front, and then acrylic panels on locators or actually studs that can be changed quite easily. So again, just as the patient comes in, they know exactly where they're going, exactly who they're coming to see.
Yeah, we've got a few different things to consider and some inspiration, hopefully. So I like this one because I like the colour contrast, but I also like the fact that they've used a different font for the logo and then for the directory down the side. It just gives it differentiates between what's information and important to the logo. So yes, the logo is nice and people know what it is and where they're going, but the formality of the different font, a more business-like font for the information boards, I like the contrast there. I think it works really, really well. And whether it's conscious or not, it does give that impression of a more formal.
Well, you look at who the clients are, it's aimed at children. You're trying to put children at that ease, coming into a place that they'll naturally be nervous about.
That's it. And it gives the business font on the left. It gives the parents reassurance, whether psychologically or not, about the professionalism of the business and the dentists. Yeah, I like that.
Okay.
Obviously, there's a few examples there there's the braille and the tactile one with colours, and obviously braille and the standoff lettering as well. And then various pictograms to help people find the right areas.
Yeah, and again, the pictograms work well because again, people with multicultural, multi-languages, it's obvious where you need to go. I think the braille and tactile is certainly one of those things that for the bigger establishments is nice. But again, think about its positioning. This one is clearly on a plinth, and the plinth is probably angled, but there's some thought has been given where it would be on the entrance as you come into the entrance, where someone actually goes to. So actually they're guided to it straight away, so they know where they're going to.
Yeah, that's really good. I like that one. Yeah, here they've used some of the privacy solutions, but they've used it to maximise the space. So they've got some information on there. So not only are they providing some privacy, but they're also sharing the information that's relevant to patients.
Yeah, and you've got the roller banners on the side there as well. Again, it's a promotional activity. If you're going out,
it is.
It might be the fact that you're running in different areas of the hospital, so those banner ups just give the information that's needed for the patients that are actually there at the time.
Excellent. Yeah, it's good. What have we got next? All right, so we're looking at the information side, so not just the name of the pharmacy, but the totem outside. So although they might not need it on their first visit, that information hopefully will register, and next time they need to know when it's open or where they park or whatever the sign may be, they will remember that and we can refer back to it.
And I think this also comes into me about the wayfinding systems as you come into a hospital or you come onto a site. The fact is that the fascia is the last thing that anybody sees. They're parked their car, they're walking towards it. The totems, the monoliths, those things that are on the adjacent part of the building or the site need to guide people to that front door. The last sign is that welcome, you've made it, you're here.
Exactly. Exactly. Let's get them to the primary destination. Perfect. So these are some examples from a particular centre's done the work. So one-piece wallpapers down the side walls. Obviously, continuation of image. There's no joins, which are also great for little picky fingers to pick at joins and things like that and seams. So a one-piece wallpaper is a great solution. It's practical, but it's also brightens up the areas.
I think that for me, these type of impacts, again, both this image and the next image, it livens up what would be a very dull area. And actually, in truth, it's probably an inexpensive way, because actually the maintenance on vinyl wallpaper and a wipe over surface is actually better than that of usually a basic paint surface that actually stains. It is
Absolutely.
something that can be revived and updated from time to time. The fact is, you're welcoming people. You know, the different languages of hello. You come through the door just takes away that intimidation. It's not going to be suitable for every location, but again, it is something that we're seeing more and more in a wider delivery to different practices.
Absolutely. Yeah, and it just proves that signage can be fun as well. It doesn't have to be practical and informative. We can have a bit of fun with it as well. So everything in here was created by Signs Express Southampton, and it just adds that extra level of
engagement, isn't it?
Engagement and making it a pleasant place to be and a pleasant experience for something that could be very stressful.
Okay. I think back to you, I'm afraid. I think
I thought this was great, but okay, it's fine.
Sorry,
So,
there we go.
So next steps, yeah, have a walk around, conduct a site survey, give us a shout or a sign company a shout, and we will come with you. We will help you do that. But it's a very good place to start. But yeah, we're going to say this, but reach out to your local Signs Express to discuss your needs. But I will play the industry card and use a professional sign company. They will help you do this, and it will definitely benefit you and your organisation.
Yeah, I just, if I could just add, I think there's the thing there is this, just don't just make it a tick box exercise, because that gives you the rating, the CQC rating. Where you're coming from is that who are you seeing, or who is your patient seeing? Where are you within that facility, and how are they getting to you? It's a really simple process if you cut it right the way back down to the basics, and make the experience a pleasant experience for someone. Take the stress away from them that they actually have probably they've already got to before they've arrived with you.
Absolutely, it can be a very anxious experience turning up at a hospital or a big site where you've never been before, and you've got an appointment and you don't know what the appointment's for or what it's going to be, what the outcome of it is. So yeah, let's make it as stress-free as possible.
Absolutely. Thank you both so much for running through that presentation. So as you can see on the screen, we do, of course, have centres all over the UK and Ireland. So you can head to that link that is on the screen right now to find your nearest Signs Express centre. Or, of course, we can be in touch after this with some details if you would like them. So we are now moving on to the Q&A portion of the session. We do have a slight delay between us presenting and when it is reaching you folks. So we will just sit here for a little bit, and we are around to answer any questions you may have. So please do use the Q&A function if you have anything for us, or of course please do reach out to us, like I said, your nearest local Signs Express centre, or through any of the links that you've received in the run up to this webinar should all lead you back to us one way or another. So all I will say is a huge thanks to Dave and Craig. We really appreciate you presenting today and sharing all of your expert knowledge with us. And for the meantime, feel free to turn your microphones off for a moment, but we will just sit here for a few minutes and just wait and see if any questions come through. But thank you all so much for sparing an hour of your busy days to come and join this call for us. We really appreciate it. Thanks very much. Oh, and we have had one question from Ruth. We will be sending around a recording of this afterwards. So if you've missed any of it at any point, if you've had to take calls and things whilst we've been chatting, that's absolutely fine. You'll be sent a recording afterwards. Let's have a look. So we do have one question here from Jeremy. So we'll see if we can answer this, folks. So either of you feel free to take this one. Jeremy has asked, is it indicated in the CQC regs for signs and displays in healthcare to be laminated, i.e. with antimicrobial coating to prevent transmission of bacteria or in sensitive areas? Thank you, and great presentation, by the way. Thanks, Jeremy. I'm glad you enjoyed it. If you are asking from kind of a CQC regulation standpoint, we probably can't answer necessarily on the nuts and bolts of what is said in the standards, as we're not representatives of the organisation. But I'm sure our David Craig here could probably answer some questions about different coatings of signs and which ones might be kind of antimicrobial or things like that. Do you have any recommendations of those, folks? What kind of signage might be best for those environments?
Well, I know in previous life, tactile signage is recommended to be cleaned down on a regular basis. Now, my issue is what counts as a regular basis. There are a number of coatings that react now to UV light. So again, they tend to be wall coatings and for areas, operating theatres and the likes as well. So the signage itself, I think a common sense approach comes into the cleaning processes that they use for the whole building. The sign should be adopted within the materials of the building, if that makes sense. But it's a very good point, because actually thinking about the products that you actually use, we have to understand the chemicals that are being used for the cleaning process. So, and that's a prime example of the posters. If you think about the posters, it tends to be a paper poster that has a lacquer over the top. And that lacquer will not withstand a lot of liquid cleaning. So that's why they tend to be behind a polycarbonate cover. So the polycarbonate can be wiped down rather than the poster. So I think,
Yeah, I was going to say, and you very often see a piece of A4 paper with something printed off on a computer in a clear wallet, blue tacked to a door. Well, that's just a breeding ground for germs, and it can't be cleaned properly. So yes, it might be temporary, but it can still be a proper sign. It doesn't have to be printed on an A4 printer.
And what would you recommend for that, Dave? Would you recommend kind of a casing, something that you can open and change around easily?
Yeah, absolutely. We got casings that'll have a front screen or a clear laminate built in, that they can just slot the paper in if they want. If people want to print their own signs and temporary ones on paper, they can print those and slide those in, but the cleaning could still be done properly on that material and still provide a safe limit the amount of bacteria transmission.
Thank you. Great. Hopefully that answered your question there, Jeremy. But like I said, please do get in touch if you've got any further questions off the back of that. I don't think we've got any others, so we probably will end this session here then, give you folks 10 minutes back of your day. So yeah, just a big thanks again for joining us today, and to Dave from Signs Express, and to Craig from the British Signs and Graphics Association for presenting for us. Thank you so much for joining, and we'll be in touch soon with the presentation and recording. So thank you,
everybody.
Thank you. Bye.
Bye-bye.